we continue with our special coverage on COVID and what's happening across the country, putting the spotlight on the state of Kerala right now. For Kerala is staring at a possible dual health challenge. A steady rise in COVID infection and COVID cases between Kerala and Maharashtra, using a majority of the cases being reported on every day now in our country. And Kerala has been an outlier in that sense, even when cases are coming down everywhere else, most of the places in our country at least. But that's not the only concern. Today in the news emerged that Zika virus has been detected and Zika virus cases have now been reported in the state. It began with one 24-year-old pregnant lady testing positive for Zika. Then more samples were sent to the National Institute of Virology, who've confirmed 14 more samples. Now, interestingly, 10 of these are health workers. So it's now become another concern that Kerala will have to look at. On the other hand, when you talk about COVID, 13,772 fresh cases, 142 deaths in the past 24 hours. We've actually also looked at the way cases have gone up and down in the last month and a half, and we found that on an average over 11,000 cases were reported in third week of June. However, this week it's gone up to 12,500 cases. The positivity rate is above 10%, which experts will tell you is something to watch out for. Not as bad as what we saw in the peak of second wave across the country, when positivity rate was shooting beyond 25% and 40%. But what is going on? Let's try and understand why we are seeing what we are in terms of COVID and now Zika. I say good evening to Dr. Sebastian Paul, former Member of Parliament for Lok Sabha of the CPI, Dr. Anish T.S., Associate Professor for Community Medicine at the Government Medical College in Tipuram, also member of the COVID expert panel there, Dr. Sunil Agar, Professor of Excellence Community Medicine in Maulana Azad College in New Delhi, member of the Lancet Commission and India Task Force. And we also have Anil Anthony of the Congress Party. Dr. Anish, let's start off with you and how you see the COVID cases trend. Why is it that we are seeing this constant rise now? Is it that Kerala in general is out of sync with rest of India's cycle? Or is there some other reason in terms of unlocking?
Actually, when we are considering Kerala, the epidemiological situation in Kerala, there is some positive things are there and some negative things are also there. I will speak about the positive things first. What is meant by flattening of the COVID curve? That necessarily means that the slope of the curve overall, it will be reduced. That means the cases start coming in a very slow rate and the cases will disappear also in a very slow rate. It will not be just like what you are seeing in India, that a sharp increase in cases and a sharp decline in cases. If the cases are increased very sharply, it is going to be decreasing very sharply also because of the rapid occur of herd immunity, maybe for a temporary herd immunity may be there. So Kerala has got its own strengths and Kerala has got the strength to capture infections, even if it is happening to the rural areas of Kerala. So the people are well aware if they have got some kind of symptoms, they will go and get their test done for COVID-19. And the reporting fidelity of COVID-19 is also very high in Kerala. It is somewhere comparable to any Western world. So that is one advantage that Kerala is. Suppose you are going to have COVID infection, what is the better time for a COVID infection? Is it along with a curve or which is actually peaking? Or is it between two curves, just like the time period now? So Kerala, actually, it is actually something good that we were able to prevent so many infections at the time of the peak of the curve. So Kerala never, actually, our systems were never saturated. And we were managing the COVID-19, the second wave of COVID-19 better than any part of the country. But the challenge is, our hospitals are, even now our hospitals are partially filled. And if you are going to have a surge now, we will not be having that kind of a capacity in our system to take care of the increasing COVID-19 cases. But as you know that in Kerala, we have got a better facilities available here, and our population is actually better equipped. And the same phenomenon that we noticed even in the first wave also. After the first wave, in overall India, the TPR was actually coming down, but in Kerala, the TPR was not reduced. It's actually a general trend in Kerala that cases are increasing very slowly, and it is actually decreasing very slowly also. That means at any point of time, Kerala, we have got cases. That is actually giving some other additional challenges that we are having a very constant fight against COVID-19. Our health workers do not get time to relax. And it is actually, there is some pandemic fatigue associated to that. And all these things are there. And now we are actually facing another issue with the Zika virus also. The Zika is actually the unknown febrile cluster. The cluster of unknown febrile illness was there in Rwanda, and it was turned to be Zika. And we have got maybe 15 patients diagnosed to have Zika. It is confirmed, but we suspect that more number of Zika infections are there in our capital city.
Yes, and I want to talk about Zika in just a bit, but what we are trying to understand is why there is this rise that we are seeing, Dr. Anish, in the COVID cases. Like you said already, there is, hospitals are partially occupied, and if it gets worse from here, it will be. Is there a, further study that needs to be done on a different kind of a variant is there, which is more virulent? Or is it simply part of the cycle that we see when people step out, cases go up?
Continuously, we are monitoring the virological data, and even 95% of our cases are Delta. And we have got the virological information readily available. It is actually done in all India basis, and we have got two other institutions in Kerala. One is Rajiv Gandhi Center for Biotechnology, and second one is Calicut Medical College. They are continuously monitoring the virological situation. And suppose these 15,000 cases is coming maybe in the last week of May, our system would have been damaged. But now our systems can take care of this much number. And I think in Kerala, we have got many number of susceptible populations still there to be infected. And gradually they are getting infected as we actually relaxing our lockdown and all.
Okay. In fact, there are always a few states which, is where we begin to see, Dr. Sebastian Paul, they seem to be leading in a trend. Maharashtra is one and Kerala is one. And whatever happens in Maharashtra or Kerala, then subsequently in Karnataka, ends up happening in the rest of the country as well in a few weeks. And then we see a spike across the country. Something that the researchers may be able to tell us why it happens at some later point. But that's how it works. Now, how is the government planning to tackle this? More movement of people is taking place. We are all unlocking more. We are hoping that the economy and the businesses also pick up. But if the cases go up and third wave hits us sooner than later, it is a problem, Dr. Paul.
Yes, it is definitely a problem. Last year, we could effectively control the spread of coronavirus because the government was so strict about it in implementing the protocol and restrictions thereupon. But now there is some relaxation all around. People want to come out of their residence. They want to resume their daily activities, and they want to go to the church. They want to go to the places of worship. They want to go to the theater. They want to go to the hotels. All those things are there. And now, although our subject of discussion is Zika, I think Zika is a problem which we can control, as we controlled Nipah 2 years back. But the spread of corona, this COVID situation, it is going beyond the control because more than a third of India's daily COVID cases recorded is in Kerala. There's an alarming situation. So I think and I hope that the government would come out with more restrictions to curb or to control the spreading of this virus. Because the situation is that it is virus versus human situation in Kerala, and Kerala being a state where we have contacts with the entire world because a hub of world travel. All types of contacts are here. So we have to remain careful, and we have to remain effectively implement the COVID protocol now.
Yeah, and before we came to the conversation of Kerala, for example, we were actually discussing the bigger challenge that's also there for a lot of other states. Holidays hotspots, vacation hotspots, tourist hotspots, and the way people are crowding there. And I think everybody is facing the same conundrum, Anil Anthony, which is how do you restrict movement forever? You can't, and then if you open up, then the cases begin to go up. Somewhere that balance has to be maintained, and maybe people need to constantly be reminded that you have to follow the COVID rules. But the states also need to ensure that there is enough testing and tracking, that we don't drop the ball on that.
Yes, that is, there is something in Kerala which we cannot explain so easily. Because in the other parts of the country also there are people, they are mingling with each other, overcrowding, all those things are there. But what is happening in Kerala, it is something which is baffling me also. Because we could control the situation during the first phase of this COVID spread. But during the second phase of the pandemic, we are providing some sort of a helplessness. The disease is spreading, the virus is spreading, and we cannot do anything. That is the situation now. And moreover, in addition to this new virus, Zika, is also coming. But at present, the Zika situation is under control. It is not spreading like anything. But I again emphasize the point that our entire attention should be devoted or should be turned towards the control of this COVID virus.
Okay, Anil, let me take that point across to you. Anil Anthony, do come in on this challenge that Kerala faces now.
Tanvi, I would like to add in, first of all, thank you for inviting me for this discussion. And I would like to say that a lot of things that is happening in Kerala, the recent events, including Zika, including the alarming rise of COVID cases, are worrisome. But if you're listening to what our Congress leadership has been pointing out in the state for the last 18 months, you can see that this was not a surprise. To be very honest, if you look at Kerala if you're looking at Kerala's healthcare evolution, if you're looking at how healthcare evolved in Kerala, you could always see that Kerala was a state which was at the top of the table when it came to most of the major healthcare indices, including the number of hospital beds, including the number of doctors, nurses, etc. per 1,000 people. We are always above the national average. And when the United Nations came up with their human development indices, right, all the way back in 1990, Kerala was at the top. So we were a state which always had good healthcare parameters. But when the pandemic started, initially because of this good foundation the state had, we actually could control it. But when compared to what my co-panelist said, I wouldn't agree that even in the first wave, we actually controlled it. Because by January 30, despite us having such a good foundation, by January 30th, we were actually responsible for almost 60% of the country's cases. So by then itself, things were actually falling apart. But then the first wave receded. But now the second wave again started. Once again, we started slow. But now by, let's say, by July first week, when almost every other state, the curve is downwards, but Kerala's curve is still not flattening, nor is it coming down. And I would say the administration as well as the government has a lot to do with many of these things. For example, like people mention about, for example, the government and even my co-panelists mentioned about certain reasons. For example, high population density. It's something which some other cities, including Delhi, Bombay, etc., have even more than Kerala, or Delta variant. It is there everywhere. People mention about, let's say, misrepresentation of cases. But just yesterday in Times of India, there was a report where an RTI was filed. And there is just for the month of July, almost 6,500 cases have been misrepresented on the number of deaths in Kerala. Like, for example, the state says there are 13,500 deaths, while the local bodies say there are 20,000 deaths. So there is, all these things are happening. Whatever is happening across the country, it is happening in Kerala also. But despite all that, the number of cases in Kerala is very high. And that, I would say, a lot to do with how the administration is handling it, where a lot of things are not scientific. For example, like, I'm just giving one example. Like 5 days of a week, like everything is open and then everything is shut on a weekend. So all these things were finally what it contributes is it actually, instead of dispersing the crowds, a lot of things the government is doing is actually increasing the crowds.
Okay,
And
so
a lot of
since you've given a specific example, let me take that back to Dr. Paul, and then I will go to our experts again. Dr. Sebastian Paul, you want to respond to this? That somewhere there is also a bit of a policy designing that you're doing, which is adding to the problem. If you say on weekends everything is shut, that just increases the crowding on weekdays.
Definitely, that is the problem. That is the real problem. Kerala is praised for its high rate of literacy and social awareness and all those things, but that does not make people to behave responsibility with the responsible citizenry. There is a difficulty now. Now people want to come out of their homes at any rate. They want to resume their daily activities. They want to enjoy life. They want to go to their places of worship. All those things are there, and the government, according to me, is not so strict about those things as it done last year. That is one reason. I am not an expert on this field, but that may be one reason. The large crowding of people in public places, that may be one of the reason for the increasing number of COVID patients in the state. The rate is very alarming. 1/3 of cases, the national figures in Kerala's contribution is 1/3 of the national figure. It is a very alarming situation, and I think the government will be coming out with more stringent measures to control the people and regulate their behavior, social behavior.
Okay, need more stringent regulations to come out and regulate people's behavior. Let's also say good evening to Sunila Garg, who's joining me on this conversation. Dr. Garg, Kerala right now is looking at two challenges. The COVID challenge that the entire country is looking at, but Kerala's rise seems to be very different from what we're seeing in many other parts of the country right now. And then comes Zika. Let's just talk about the COVID aspect. Any insights into why it continues to see this rise?
Tanvi, you are very, very right that, basically we have to see that why Kerala is seeing the rise. I can see two important reasons. One of the things is that, we have to very closely monitor, how the cases have been. From 5th, if I'll see, July, we had 8,037 cases, and yesterday we had 13,000 cases. Kerala is seeing a rise. But Kerala also has 45% of the population which is immunized. That is one thing which you have to see. But Kerala has not had zero survey since a long time, which we need to look at very, very appropriately, that basically to what extent is that a number of people who have not got the infection, or you see there's a huge chunk of population, because otherwise the recent zero survey which came out from AIMS that showed that 60% of the population is having, from rural and urban areas, they are having zero positivity, and that was seen in Delhi also. So we need to look very closely at the zero survey results as well. Another thing is that we need to monitor the genome sequencing also very closely. But one thing I like to say, that when I first did this whole panel after or during the first wave, Kerala was one state which I quoted it for best practices. And that is from where, and Kerala is known for having a very good systems approach. So we need to look something beyond that exactly, what could be the reasons. So reason could be a large chunk of population which is not infected. The second thing could be we need to look at the variants part. So that will be another thing which we need to look at. And COVID appropriate behavior, as has been just pointed out, that how people are, just going outside without, following any precautions, without wearing any masks and all that. That could be one of the reasons. Even if high population density alone will not, make a difference unless people are following COVID appropriate behavior. So these are some of the things which come to my mind.
Okay, Dr. Anish, let's get to the second aspect, because, that's also extremely interesting. Now, when the news of Zika case first emerged, it was a little surprising for us, especially those people who don't obviously track how these infections spread too much or know the science behind it too much. But our understanding was that a lot of it comes from travelers who've perhaps been to other continents, something that hasn't happened in the last few months so much because of COVID. Any insights as to how this virus seems to have landed in Kerala and infected so many healthcare workers?
Before answering that question, I have a comment on the previous issue.
Sure.
That if you look at Kerala, for example, January, as Mr. Anil Anthony was saying, 60% of cases are from Kerala. Even now, more than 1/3 is from Kerala. But this is not a peak situation. This is actually somewhere we can manage. So suppose you look at the peak situation, maybe in May, where the India was actually surging with more than 4 lakh cases. Kerala was contributing less than 10% of the total cases. That means our large numbers are actually between curves so that we can manage. But when the India is speaking, our cases are actually comparatively low, and never Kerala system was actually overwhelmed. That is an advantage that we have because we are not able to prevent cases, but we are distributing the number of cases for a longer period of time. We are actually having cases maybe this time, but now we can manage these cases. So we have to consider that also along with in this discussion. That is one point that I want to make. And regarding Zika, definitely Kerala was witnessing a large number of influx of expatriates from different parts of the world in COVID situation. That may be a reason that Zika is introduced because we have got very strong surveillance for Zika virus from 2016 onwards by Vector Control Research Center in Kottayam. They were testing thousands of cases having clinical symptoms just like dengue, and it is negative for dengue. And they were not able to pick up any Zika cases till now. But now we have got a Zika case, as I have already pointed out. It is actually happening in Trivandrum, the capital city of Kerala. And this person, this antenatal woman, was tested accidentally for Zika in a private lab. And we were retrospectively analyzing the samples collected and sent to the NIV Pune, and we found that 15% of them were turned to be Zika. And it was actually from a private hospital in Trivandrum city. The samples were sent. I think that may be a reason that the many healthcare workers are included in the pool. And as Tanvi, you rightly pointed out, that may be a contact with the foreigners or the people coming from abroad, may be a reason that more healthcare workers are affected by Zika. But don't think that it is a cluster of healthcare workers. Definitely, we have got a cluster of febrile illness in Trivandrum. That may be a Zika outbreak that we are actually looking into the matter. So it is actually a matter of concern because the Zika can affect our pregnant woman, and it has got very bad consequences.
Yes, yes. So, like you rightly, explained to our viewers as well, a larger research that was going on into dengue and other kinds of infections is how we stumbled upon this, and is definitely a big concern. Dr. Garg, how do we, what would be the appropriate response? How do we go around handling this? Because it's not the usual times and just another outbreak. We're already in the middle of a pandemic, and now this.
You see, basically, we have to look at both the situations together. On one hand, we have to manage COVID, but on the second hand, the Zika infection, which is quite serious in cases of pregnant women, and we need to monitor this, and we need to do the contact tracing very, very exhaustively. And we need to also, at the same time, put a lot of kind of pressure on our national vector-borne control program, which I know is working quite well in Kerala. Then again, you see, still the number of cases are there, so we need to do extensive contact tracing, which will bring out the number of cases also beyond. So as we know that, it is now, we have got about 15 cases which are there in Kerala. So we need to look at all this. And plus, we need to, kind of create awareness that those people who are suffering from fever, myalgia, rash and all, they must come forward and get themselves checked up also. So it is, I know that for Kerala, it's a dual kind of a situation, but we need to monitor them very carefully.
But what I am trying to understand, Dr. Paul, and maybe you can come in on this as well, in our response now to Zika cases, will it have to be something that we need to spread across multiple towns to do checks? How do we make people aware of what a challenge this is? Because this is the first case this time in Kerala. People need to also know how to go about it and what to be prepared for. So, what is the government's thought process there? Dr. Sebastian Paul, yes.
Yes, I can hear you. As we all know, Zika is a mosquito-borne disease. The mosquitoes are visible. We can kill or we can destroy the mosquitoes and prevent the spread of Zika. But that is not the case with corona. Coronavirus is invisible. We cannot kill that virus. The situation now is that with more and more people getting vaccinated in Kerala, the incidence of corona is also increasing. That is a strange situation. Like I don't know what is the reason for all those things. But I still repeat my argument that government should enforce these measures very strictly, and people should abide by this protocol. Otherwise, the situation will be getting more and more alarmed. The Zika, although our topic of subject for the day is Zika, Zika is controllable. We can control it. It is already under control. But that is not the case with COVID.
No, but can we say, Dr. Anish, that Zika is under control right now, because we wouldn't still know the extent of it, right, Dr. Anish?
We cannot say.
We do not know because the extent of it, because Zika is actually it has got a very mild clinical features. Usually 4 out of 5 will not have any serious illness, so these people will not come to hospital. So we a thorough investigation only will tell you how much it is spread. Maybe it was spread from Trivandrum, from other districts, and all other things has to be looked into. Because Zika is a milder form of infection, so we will not. It is very difficult for us to surveil it out. But definitely we have got a very good practice. As Madam has already mentioned, that we have got a very good practice of the vector control and other measures in Kerala also. And definitely we will just track these things, and we will find a solution. Definitely Kerala is well taken forward.
Yes. What would we need from the center here? I understand, Dr. Garg, already a team of 6 experts has decided center has decided that they will be sent to Kerala and will jointly work with the local team there. But again, I come back to this point. What should the people know? How do we make people aware of what they are staring at?
You see, primarily they need to be aware of what are the, how the Zika virus is spreading, number one. Number two is that, we need to know basically, apart from the mosquito-borne this thing also, that it is got from mosquito, there is another route, that is sexual route also, which is responsible for transmission of infection. The third part is, we need to prevent the accumulation of water, stagnant water. We need to put larvicides very regularly. The central team will be to go and monitor about the number of cases, the contact tracing, and then also looking at the laboratory part. And overall, holistic management will be the part. The team which has gone from Delhi will also look at the comprehensive, control plan, as well as, how we have to go about with looking at the number of cases, and how we have to prevent also, subsequent cases. But basic thing is that we need to create awareness. Look at the stagnant water, which you are showing exactly, basically, this is how, the Zika infection spreads like any other vector-borne diseases. Because it is Aedes aegypti and Aedes albopictus. They're both, day biters and night biters. So we need to talk to people and create awareness about, how to prevent, these vector-borne infections. So these are some of the things, and the central team is definitely going to take a holistic view of the whole situation, right from the number of cases to the extent and how to prevent and how to strengthen the laboratory part also. And where, NIV Pune also has got a very important role to play.
Yes, I think even in terms of the testing and tracking, we'll have to move very, very quickly at this point. Of course, understandable that many of these labs are already dealing with a lot of burden of testing and for COVID and surveillance for various variants which are there and studying those. But in times of a pandemic, if a state begins to see an outbreak of another infection, another virus which is, which behaves in a completely different manner than COVID, then a completely different set of response will also have to be planned by the government, by the state, and people will need to be made aware of it. And if already 10 healthcare workers have it, then there's a larger concern of people getting exposed there because of some travelers who may have come in. So much work to be done there as far as Zika is concerned. Also will be interesting to see how Kerala handles the rising cases. I'm going to thank all of the panelists for joining us right now. Why are we discussing Kerala? Because of this dual challenge. When it comes to COVID as well, Kerala and Maharashtra are still the states now which account for a majority of the daily cases that India registers. Not something new. We've seen that many times over the last 1.5 years. These are the states that are usually ahead of the curve, see a massive, rise. And when things begin to come under control here, taper down, is when you see in the rest of the country. But even Maharashtra is not seeing this kind of a problem right now. May happen in a couple of weeks, we don't know. The only thing that we do know is we cannot let our guard down. The only thing that anybody sitting in Uttarakhand, Delhi, Mumbai or anywhere in Kerala knows is that you cannot let your guard down. We need to continue being careful, following COVID appropriate behavior even if things begin to open up. Governments need to ensure that do proper testing and surveillance. The experts need to be on their toes, constantly studying the information that is coming in, analyzing the numbers that they are getting to see what's going on. Only then will we be able to tackle this crisis on time and have a timely response to any challenge that comes across. We're tracking the situation in Kerala very closely.